It's really, really important because we are the biggest public sector organisation and we have to show action. So we need, as a health service, to protect people from the impact of climate change.
Welcome to the HSE Talking Health and Wellbeing podcast. My name is Eamon Keogh. The HSE's climate action strategy has moved from plan to action. We've seen encouraging progress from a number of fantastic dedicated people leading the way, but business as usual with a minor few tweaks won't get us there. The task lies with all of us, both collectively and individually. Every little change matters. It's about sharing, celebrating and measuring what works so that we can improve and continue to make a real positive impact. In this episode, we'll cover what the top priorities are now from a healthcare perspective when it comes to climate change. What real results are being delivered across the health service, from green theatres, greener labs, to innovative catering and waste disposal solutions. I'm delighted to be joined to talk through all of this by Roisin Breen, Programme Manager, HSE Climate Action and Sustainability Programme, and Dr. Ulla Loken Nordrum, HSE Fellow with the Climate Action and Sustainability Programme in conjunction with the HSE Spark Innovation Programme. You're both very welcome. Ulla, we might start with you. When we think about the climate crisis, as we think about weather patterns, temperatures rising, but can you briefly just take us through where we're at the moment?
Yeah, we have to set the backdrop for this. And last year, which is 2024, we had record high emissions, 53 gigatons of CO2 equivalents. We reached 1.4 degrees of global warming, and we're now starting to see tipping points, such as the coral reefs starting to die off. And realistically, every year we're seeing that the gap between the commitments we're making and the reality just keeps growing.
Yeah, okay. Then bringing that into a healthcare context, what does climate change mean for health and healthcare?
Yeah, the WHO has come out and said that the climate crisis is the biggest threat to human health of the 21st century. And it's a bit difficult to conceptualize this health crisis because it affects basically everything and every organ system in the human body.
Yeah.
So we are seeing worsening diseases, new diseases. It worsens inequalities and it threatens the very sort of social and economic foundations which we built the current healthcare systems on. So it's threatening our ability to provide healthcare as a healthcare service. One very stark example of the sort of health crisis that is the climate crisis is a report from Doctors for the Environment in Australia who have now found that fossil fuels, through a myriad of different diseases, kill more people than smoking every year. And that's a stark reminder of sort of what's happening. And it's not something you see and experience every day, but it's sort of always there in the background affecting our health in basically any way possible. So if you mention an organ system or a part of the body, it will be affected by climate change in some shape or form.
Okay. So really the health sector is central to this.
Yeah, as a healthcare sector, we both have to adapt to what's happening and sort of be that recipient of all the health effects of climate change. But we also have to adapt ourselves because I think we mentioned this when Roisin was on the podcast last year that the healthcare sector globally is responsible for about 4 or 5% of global emissions. And that might sound like a small bit to you, but that is a fairly significant number. But I think if you take one step back, the healthcare sector in terms of global spending is about 10% of the global GDP. That really shows us that the healthcare sector has this enormous power to sort of instigate change and sort of see change ripple from healthcare essentially throughout society. And I think if we can start moving within healthcare sector and make the way we provide healthcare more sustainable, reduce our emissions, we could really move mountains and really see our effects throughout society. We have a central role when it comes to sort of instigating the change we need to see. And healthcare is perfectly situated to be leading when it comes to climate and nature action.
When you think of all the suppliers that the HSE deal with and the influence that we could have potentially there, but also then when you look from a service user perspective or a patient's perspective, the influence that we can have there as well.
Absolutely. So I think it's important that, I suppose, the healthcare sector is an advocate for patients and service users across the country, and that we provide information and really educate the public about the health effects the climate crisis is already having on them.
Yeah.
Whether or not it's obvious to them in the moment. But I think we have an important role there to play. And I suppose a good example is, air pollution in Ireland. which is probably the most obvious example of the climate crisis at the moment. And that causes about 1,300 to about 1,600 deaths per year. And that is just deaths. That doesn't include morbidity and all the other health consequences that is obviously negatively impacting quality of life, which is just one example. But I think talking about climate change and health effects in Ireland is obviously, it's a podcast on its own. So it's something we can kind of spend hours talking about. So I think that's probably a bit beyond the sort of scope of this podcast, but I think it's something we can do in a future podcast maybe.
Okay. And then maybe just talking about the misconceptions that are there about climate and health.
Yeah, so I think there's two misconceptions that I think we often come across. And I think the first one is that people seem to have this idea that it mightn't affect you.
Yeah.
And the answer to that is it will, and it probably already is.
Mm.
And the second is you might think someone else will fix it, and they won't. Those two misconceptions are very important to sort of move beyond and get people to understand that A, they have a role to play in this,
Yeah.
and B, it is affecting you. And that we all have to sort of come together and act because no one is coming to save us. We've seen that through decades of COPs and climate conferences and policies.
Yeah.
This is up to us now as an individual, but also as a healthcare service and a society.
Yeah. And it's like that if everyone makes small changes, it can lead to big outcomes,
Absolutely,
really, can't it? Yeah. Very good. And Roisin, good to have you back with us. When you spoke to my colleague Fergal in episode 76, you were talking about the HSE climate strategy. So I suppose now we're 2 years on from that being published. So what progress has been made?
Thanks, Eamon, and it's good to be back. We've been busy bees in the HSE's Climate Action Sustainability Programme. We've moved away from the strategy and we have published 7 frameworks across a number of the various priority areas. We'd had around 200 people involved in that work, so lots and lots of people from within the organisation and outside. Those frameworks, I think, are really important because they chart a roadmap of where we are currently and what actions and interventions we really need to put in place to ensure sustainability across those priority areas. So it calls out actions for senior leaders within the organisation, for staff on the ground, for groups, collective action in all of our services. We also have now a measure of our carbon footprint within the HSE. Although there are flaws, we have a methodology and a baseline now from which we can chart improvements.
Okay.
So this exercise does also call out particular areas where we can have a real impact for carbon reductions, such as Kaplan Estates in our buildings and retrofitting our buildings to anaesthetic gases and inhalers. We've also done lots of things like supporting green teams. We've an internal communication campaign. We've launched a hub. We've had a national conference and supported innovation for product development as well. So lots of really positive things happening.
Very good. So you have been busy. Very good. Ulla touched on it there in terms of the role of health in climate change. But why is it critical for the HSE to take a leading role in this?
Yeah, I think, Eamon, it's really, really important because we are the biggest public sector organisation and we have to show action. So we need, as a health service, to protect people from the impact of climate change and, on the other hand, as Ulla talked about earlier, reduce our contribution in terms of emissions. But also, I think from a government perspective, we have to comply with legislation. There's an expectation that we will deliver on the Government Climate Action Plan and the public sector mandate. Also, I think if you look at recent research from the Environmental Protection Agency, 89% of the general public say that climate is important to them and that they want to see climate action delivered within Ireland. And I think as healthcare professionals, we're really trusted and in a really good place to make that happen.
Yeah. Okay, very good. And you mentioned a number of areas there, but I suppose of the strategy focus areas, which one or two do you think can have the highest impact for us?
It wouldn't be right to say that all of them are really important.
Yeah,
but I think,
course,
to highlight here, I think it's important to say that Greener Models of Care is a real tenant programme. It has tentacles into all of the other frameworks. So if we take an example, if Mary is coming in for a knee replacement, we need to look at that care pathway from start, middle to end. So how does Mary get to the hospital? How does she travel there? When she comes into the hospital, are her notes taken electronically or on paper? What is the waste produced across that care pathway? What water and electricity is used? Is there opportunities to reduce that? Is there over testing? Is there too many images being taken? Is she being prescribed too many medications that maybe she doesn't need and will end up throwing them in the bin? Thinking about the equipment that is used, so reduce, reuse, recycle. And also it comes down to what food did Mary consume when she was in the hospital? Was there sustainable options? And also think about the food waste that's incurred.
Yeah.
So all staff across that care pathway are involved. And secondly, it would be remiss of me not to mention procurement. Procurement is a really massive part of where our emissions come from. So it's part of our Scope 3 emissions, which really Scope 3 means emissions related to what we buy. So it accounts for 70% of our emissions. So we really need to look at what we purchase. We need to work with our suppliers to ensure they operate sustainably and look for more environmentally friendly alternatives to products that we buy. So there's huge scope for improvement in areas like pharmaceuticals, medical equipment, etc.
Yeah.
Just to come in on that, because when I started in this role a few months ago, I got heavily involved in this Greener Models of Healthcare framework. And I'm very happy with how it tries to encompass all the different parts of healthcare. So we have topics like mental health, radiology, green theatres and anaesthetic gases. So it really tries to sort of encompass all of healthcare and try to sort of provide a bit of guidance to whatever specialty or whatever area you work in. What I really want to highlight as well is it's definitely a document that's work in progress. So it's going to be alive and it's going to keep developing as we see developments either from procurement point of view or from manufacturers developing new products, so that it's a document that is obviously published today, but that sort of going forward, it's going to be added to. We're going to keep it up to date and keep it so that it's a document people can actually look at and kind of get that tangible advice they need. It's a document people will actually use and not just sort of have as a policy document in the background.
Yeah.
And I think as well, Ula, it would be important to say that we had patients and service users feed into that,
Okay.
which was great to get their perspective as well.
Yeah, that's important. Yeah, it's a working document that's not just on the shelf or just left to side.
Yeah, and we're already seeing almost like this was only published a few weeks ago.
Yeah.
And we're already seeing that some of the sections in that is, if not outdated, but it's the developments have happened within like a few weeks or months since that document was sort of finalized. And that is kind of what we want to see. So it's a document that we constantly have to keep looking back at and sort of see, is something there not up to date? Do we need to address that? And do we need to add something to it? Which I think is a great thing to be part of within the Climate and Sustainability Office.
Yeah, very good. Just come back to the pathways you were talking about there earlier, Roisin. It just struck me when you were describing the journey of the patient. There's so many touch points there where people can actually
Absolutely, yeah.
change behaviour or tweak something just that can have a positive impact. But can I just ask you maybe about other simple actions that HSE, particularly leadership or staff, can take to continue that we move from strategy to delivery?
Yeah, I think we're at a really important juncture now. We really need to know where we need to put our energies. So we need to move from what we need to do to how we are going to do it. So we are investing in our senior leaders within the organisation. So we're doing some training programmes. We'll touch on that later as well. But we need to make sure that senior leaders make this a priority, that it has a place in senior leadership committees, etc. And also that there's monitoring in place so that we can show progress, so that there's measures and key performance indicators. Also, I think we have done a number of different staff campaigns, which are full of simple actions that staff can take across the priority areas of focus. Another thing is that leaders can, really encourage staff to join their green teams. And just on the ground, all staff just to try and talk to colleagues, get interested people on board and talk to your patients.
Yeah.
Make every contact count. Talk to them about, preventative healthcare. Talk to them about those opportunities to be more environmentally conscious. So we need to move urgently, both at an individual level, but also at a collective level, to turn these actions into reality and deliver a more sustainable healthcare together.
Actually, there was a point in the last podcast that struck me, and sometimes when we talk about the green agenda, we talk about recycling, but you're making the point about reducing what we use. So I think even, for staff thinking about that, how can I reduce what I'm doing or, as you say, in terms of food or whatever it is, that we can all collectively reduce?
Yeah, absolutely.
I think it's important to highlight there that recycling can be a very good way to sort of get it into all of this work, but it's definitely something that we need to move beyond. So I'm always very keen to emphasize that recycling is fantastic and it's a great place to start.
Yeah.
But then do something else and then do something else. recycling can't be the only thing you do, because that's the wrong end to make any meaningful change. It's a good starting point by all means, but it's not where we need to be.
Okay. So maybe if we move on, Roisin, you mentioned training available to staff, but Ulla, I might bring you in here. What are we doing, or what's the HSE doing about training staff in sustainability?
So we've just launched our Climate and Sustainability Learning Hub on HseLand, which is a fantastic resource that really tries to cover a lot of what we think staff will need going forward. So we have an introduction module on climate change and health and sustainability that's sort of aimed at all staff. That's sort of starting point.
Yeah.
But we aim to build on that as well and kind of create these more subspecialty modules as well, like Green ED or Greener Theatre, so that there's something for everyone, regardless of where you work in the healthcare service. And in addition to that, we want to create a sort of library of resources so that people can log on to this HseLand area and really find good initiatives and share stories and share what they've done, so that people can collaborate and kind of come together and stop that whole idea of people copying and sort of not collaborating and not talking to each other. So we try and prevent this sort of siloing of the healthcare service. And I think in addition to that, we're going to do some webinars on the frameworks that Roisin mentions. We're going to try and introduce that to, I suppose, as broad a healthcare group as possible, so that everyone can get an introduction to this. And then we've also been working with Change by Degrees to do some leadership training in terms of climate action sustainability, which has had really good uptake. So we have about 100 people out of 160 who signed up, who's already finished it. And the feedback is very good. So we're sort of trying to educate these leaders within climate action throughout the healthcare service to sort of lead the way. So there's a lot going on, and I think this sort of HseLand module is a really good starting point to really sort of build on the movement and create that hub that we need where people can log on and really get inspired to act.
And I think it would be important to say, Ulla, that the demand is huge for this. We put out training and it gets oversubscribed and there's waiting lists. So that's why we then developed the hub to meet that demand, and we hope to continue to grow and develop that based on what our learners require.
Okay. And how do staff access it through HseLand?
Yeah, and actually the general public can access it as well. There's an open access part to it. So certainly if anyone wants to contact us on climate and sustainability at hse.ie, we can provide some information. Yeah.
And can I ask you, what has been the reaction from staff who've completed the training?
Yeah, I suppose, as I mentioned, I think people find it very meaningful and something that they've been missing.
Yeah.
Because I do think there's a lot of people out there, a lot of healthcare staff out there that really wants to do something, but they lack that sort of little bit of knowledge to sort of get going.
Yeah.
So that has been definitely some feedback that we've gotten, that this has been missing. And then I suppose from the leadership course in particular, like they felt it's energizing and really thought-provoking, and that they've really gained the sort of valuable insight into the levers we need to push and like where to put our effort to make the most of our effort in terms of meaningful change.
Very good. The training course is there, and I can certainly hear the implementation. So you have the training there available to all staff, but we have mentioned the green teams a few times. Maybe if you could just explain a little bit, Roisin, what a green team is.
Yeah, no problem. So green teams within the HSE are really growing and growing. We've probably at this stage over 150 green teams.
Very good.
So some of them move from being energy teams to green teams. So really, green teams are a group of people within any healthcare facility who come together around that common goal of environmental sustainability. So the goal is to promote eco-friendly practices, decrease environmental impact of healthcare. So the way these have been set up, some of them have been very organic, where there's been one or two people who are really motivated in this space and get talking and start doing a little bit of work. But also it can be set up on a more formal platform, in that like a manager has brought together, asked for people to nominate themselves on. So either or. So we've seen these develop and grow massively, especially within the last year to 2 years. I think it would be important to say as well, Eamon, that these are multidisciplinary. So it can be porters, nurses, doctors, cleaners, healthcare managers, can be anyone working within the facility. And also we've seen examples where service users and patients are actually getting involved in more kind of community-based ones, which is fantastic. So lots of different projects, really great stuff on waste, which might need to better waste practices and better waste infrastructure in terms of bin and accessibility to bins. Green projects, so looking at their green spaces, and some services have even started to plant their own fruit and veg and have a little market on site. food waste projects, and then lots and lots of different clinical projects. So I think green teams really are the catalyst going forward. And to anyone listening, if you aren't in a green team and you're interested, seek it out or talk to your manager about potentially setting up one, or your like-minded colleagues who want to get involved.
Yeah. And I'm sure when you start talking about this, you find like-minded colleagues very easily, because it's on all our minds really, isn't it? And how are the 6 regional networks, I suppose, now that we're in that regional space, how are they supporting local action?
Well, I must say we have 6 fantastic regional leads in place, and they're in position to support people in the region with this work. They link very much with our programme and kind of are up to speed in all the guidance, the measures, the campaigns, the training, everything that we have, and would promote that out within their region. So they're in the process, if not having already set up a regional green committee. So these committees have also set up regional networks for the local green teams to feed into. So we have attended many regional network events where local green teams come, share their learning, speak about their projects, talk about potentially spreading throughout the region, also talk about how this is hard work. It's like there's stumbling blocks, there can be issues, but troubleshoot that out together. And then we have an opportunity then to, if there's something really good happening in one region, to look to spread that across all regions.
Okay. And then what support or training can green teams expect?
Yeah, so at the moment we're just about to launch our regional green team training. So 2 of the regional committees are attending that pre-Christmas, and after Christmas the rest will. And really the fundamental point of that will be that each regional committee will have a green action plan. So out of all of the guidance that we've created, all of the frameworks, we're really going to narrow it down to priority actions in each of the spaces that these regional committees will work to implement across the sites within their region.
Yeah.
And also moving into that space of showing improvements and tracking improvements and measuring. So next year also we really want to focus in enabling that local green teams. So local teams in primary care centres, in smaller disability units, etc. And also, I suppose, as well, as Ulla said, we want to roll out some more kind of webinars to support people. So yeah, lots of opportunities and exciting things planned.
Very good. And for staff listening who want to get involved, I mean, you mentioned there about talking to their line manager, seeking out like-minded colleagues, but I suppose really what should they do? Anything else?
I think it's such a heartening space to work in. People who are working in this space are so energised. It's a really positive space. I think if you've got ideas, seek out your local green team. I think also it would be important to mention Capital and Estates have sustainability officers in each of the regions as well.
Right. That
can support people in particularly around like building works and waste and water areas. Those are the key areas that they would work on, and also on green spaces. But also I think it's not just about staff on the ground, but it's about making sure managers and leaders encourage their staff to get involved and support them with the time that it's needed to implement these initiatives.
Yeah, very good.
Just to add to that, sorry, I mean, I'm a fairly, I suppose, young clinician, but I would very much encourage young healthcare professionals to really try and put themselves out there and try and do something, because I find that it's very useful to have someone who's young and coming into a service and coming into a new job, because they have that sort of critical eye where they can look at something that's being done within that service and say, like, why are you doing that?
Yeah.
And they might have that ability to see, oh, but that doesn't make sense. Can we change that? So I would really encourage that for those senior healthcare professionals that are out there to try and enable your younger colleagues. And you mightn't yourself have the skills or the knowledge about this to do it yourself.
Yeah.
But you might, through your role and through your connections, be able to facilitate someone younger with the skills and the energy to do what's necessary and to implement some meaningful change. So it's that sort of symbiosis between young people with the energy and the skills and the senior people that might have the connections and the ability to open the doors that needs to be opened. That's been very powerful as someone who's like started doing this work as a medical student and now find myself in this role, that the ability for those senior people to kind of see that you have the ability to make a meaningful difference here if I just help you a small bit. That's a very powerful thing that we need to sort of enable. And that's building on the green teams and the MDT approach where everyone can kind of come together regardless of where you're from in the hospital, in the healthcare setting, and you all have an equal role to play and an equal voice. And I think that is something we need to keep within the sort of climate sustainability movement, that we all have a equally important voice and an equally important role to play, and that this try and flatten the structures that we see sort of in the healthcare service overall.
Yeah. And I mean, if there's a staff member listening or really passionate about this, they should really be pushing an open door, because from what you've said, the organisation or the HSE is really buying into this.
Yeah, I think so. And from the HSE board, from the senior leadership team, everyone is on board with this and wants to move to this space. So I think, all hands on deck.
Yeah, and as you were saying, Ula, you mightn't have the answer yourself, but certainly from all the projects that are going on, all the learnings, someone will have it or someone will support. It sounds like you're creating a great support network there for both outcomes and initiatives that are coming up.
Absolutely, yeah. We have a lot of very good people out there throughout the healthcare service, and if you just push the buttons and get them going with all the work we're doing now, we're really onto something. You get that feeling. Roisin can contradict me now, she doesn't agree, but I think you have the feeling within the climate office anyways that we're sort of on the cusp of sort of creating that momentum that we need, and that all the hard work we put down over the years, both in the office, but also I think we need to, in doing this with the green teams and all, I think we should really thank all the volunteers that have put in so much work over the years to really get this off the line. Because I think we mentioned that with the frameworks, we've had hundreds of people involved as stakeholders, and mainly doing this on their own time in the evenings, on the weekends. So I think if we can kind of enable these people now to come together, we have the right sort of tools in the toolbox here now. So there is that sort of feeling that we're sort of, there is something there, and we can just the tiny bit we're missing.
Yeah. And also, I mean, it's fantastic. You have service users, the patients involved and given their input. So clearly it's important to them as well.
Mm-hmm. And I think that's something, though, that we have got feedback from patients and the general public, indeed, about potential training and education on this. Because, sometimes people don't really understand what the climate impact on health is, and indeed why the HSE would even be bothered working on this. So really one of our priorities for next year would be to do that, to do a programme where we can educate the general public on this.
Yeah, very good. And actually that leads us nicely into, I was just going to ask you about the proven changes that are already having a positive impact across the HSE.
It's almost one of those questions that's almost impossible to answer because there's so much happening.
Yeah.
And I suppose it's important to try and emphasize that these can be very small things, very local initiatives, and they can be very big ones. So we have, say, the Green Theatres initiative, where they're implementing a Green Theatre checklist, which is going to be this big tool that's going to be hopefully implemented across the HSE to try and make the theatre setting, which is this very carbon intensive part of the healthcare service, more sustainable. The College of Anaesthetists is doing fantastic work on nitrous oxide, which is this very potent greenhouse gas that we need to try and reduce the emissions from, which is another area that you can actually see when you look onto the carbon footprint of the HSE. It's actually there as an individual thing, nitrous oxide, which is this gas we use in, say, maternity ward as Entonox, so gas and air. But it's a very potent greenhouse gas. So what we're doing work with the College of Anaesthetists is to try and reduce the emissions associated with the use of this gas. So what's issues is that there's leaks in the pipeworks around the hospital or the site, or there's issues with that manifold. We have all those big cylinders you might have seen on TV. And it's about addressing all of those things in the background. And it's not about taking away the Entonox and the gas and air. That is obviously still going to be there, but it's trying to fix all the issues around it. We know from fantastic work in Scotland that the majority of emissions from nitrous oxide doesn't come from the clinical use. So that is absolutely fine. It comes from leaky pipes and issues behind the walls where you can't see it. So we're doing fantastic work with that. Again, saving money, saving carbon or carbon equivalents. There's fantastic work in the ED settings. The ED doctors have just launched a Green Emergency Medicine Playbook, which again sets out fantastic guidelines in terms of how you can green the ED service. And fantastic kind of simple things like reducing the amount of cannulas, the plastic tubing you put in to give an IV medication. By reducing the amount of dose you put in, you obviously save a lot of money. But again, you save carbon because all this has to be manufactured and disposed of. And simple things like that, and turning down the brightness on the screens in EDs across the country, mightn't sound like a lot. But again, if you start adding this up and having this in guidelines for everyone to follow, it makes a difference. In Tala, they've been doing fantastic work with changing inhalers. I know we mentioned this on Philip and Roisin at the last podcast. Inhalers with that propellant that propels the medication, that's the problem, not the medication. If they're, again, very potent greenhouse gases. So again, by changing the type of inhalers we prescribe in Tala, they've been able to reduce emissions by 20%. And again, if that's one hospital, again, spread that out through the country, and that makes a huge difference. And now we have new inhaler types coming out in the market, and again, that will make a massive difference.
And we're back to procurement as well, though, aren't we here? Like in terms of what we're buying in terms of our supplies.
Absolutely. So it's through new EU regulations that's coming in and going to procurement and going to manufacturers saying this needs to be addressed. We can't keep manufacturing inhalers that are so damaging for the environment. Obviously, no one's taking away anyone's inhaler. That is by no means what we're saying. But we're just changing the way the inhalers are giving you the medication. So we are sort of seeing fantastic progress there. And then again, looking back to, say, Green Labs, there's a fantastic initiative mainly run by Dr. Anna Rakovac, who's really been pushing for making the laboratory services across the HSE more sustainable. And we have now, I think, 30 labs or so signed up to this My Green Lab initiative.
And can you give us some examples of what that means?
So basically, I'm not a chemical pathologist now, but it looks at the entire process in terms of reducing the amount of tests being ordered, starting from the clinical end, but then also in terms of how the chemicals are procured and the type of chemicals, dealing with the waste of chemicals used to actually process the samples. And then also the type of machine, like the machines they use, making sure that the machines they use are not terribly old, not terribly energy inefficient, that is addressed as well. And then obviously waste is a big issue because a lot of the waste that's produced in labs would be clinical waste and needs to be incinerated. So reducing the amount of waste produced as well is all key. So there's like these guidelines again being sent out to these labs for the clinicians and the lab technicians for them to follow. And these are the experts. I apologize now if I butchered their work, but it's just to try and kind of show the width of the action going on within the HSE. And that there's sort of a pocket of change for everyone, regardless of a specialty you work in, or regardless of what role you have. There is sort of something you can find and do that can make a difference.
And as time goes on, the learnings from this, as we've said over, but they can be scaled up and applied across different settings.
And that's exactly what we're trying to do in our office, is that take all the learnings from all these projects and try to roll them out through the regional committees and through the regional sustainability leads. And I think, it would be important to say as well, Ula's mentioned a lot of clinical green projects, but there are other things that are happening, for example, in the capital and estates space. So really excellent work delivering on their infrastructure decarbonisation roadmap. And some of our listeners might have received funding or support from the energy officers and sustainability officers within capital and estates. We actually achieved ISO 5001, which is an energy management standard under the Government Climate Action Plan, which was a huge win for an organisation as complex as the HSE.
Very good, yeah.
And also, just to mention, the HSE's capital and estates would do a lot of deep energy and carbon retrofitting. So there's a really nice example that won an award recently at our Climate and Recognition Awards, which was from Maynooth Community Care Unit, did a massive project across the centre, upgrading of lighting, looking at their insulation, upgrades of piping and meters, and also green spaces projects. Like, that's only to name a few of the things they did. But they've seen like 26 tons carbon reduction of emissions, which is amazing.
Yeah.
And also maybe one other, we could go on for days on this because there's some fantastic projects. But one other thing to mention would be maybe one around food. So food is a massive problem and food waste is a big problem. So our procurement colleagues have a catering manager group, which is really great and really proactive. So looking at more sustainable diet options to offer our patients, but also looking at the waste end. And Drogheda Hospital worked with Positive Carbon using AI technology to identify and measure food waste. And they've seen massive positive results, a reduction by 63% in food waste costs.
Wow.
And 38% reduction in food waste just by working through that particular initiative. So really looking to expand all of those great things. Yeah.
Very good. I mean, you've hit on a point there as well. I mean, we're talking about the reduction. It's important for us and it's in terms of the sustainability, but there's a cost saving as well if we do this right, from even looking at it from a financial perspective.
Mm-hmm.
So
Absolutely.
At a time when we are trying to save money and give the most efficient service at the best possible price. So initiatives like that.
Important thing to say would be there, it's really around short-term pain for long-term gain. There may be a little bit more upfront cost in the first year or two, but we will start to see savings accumulate over time. Absolutely. Yeah.
Very good. We're coming to the end of the episode now, but Ula, I might just come back to you just with a final question. If we change how we talk about this, what one phrase would you like listeners to use instead of, we hear about net zero healthcare?
I think there's probably a few phrases I'd like to change, but like the net zero one's probably a very good example to start off with. And net zero is this sort of unicorn type term that doesn't mean an awful lot to a lot of people. We say net zero by 2050 and like nobody really knows what that means. But basically it relies on this technology that will capture carbon out of the atmosphere and turn it into not carbon. And all these technologies, they don't exist yet and certainly will unlikely to exist on the scale we need them by 2050. So what we ought to talk about instead is real zero. And what basically that entails instead then is that we need to reduce emissions now. There's no point talking about what we're going to do in the future in terms of we're going to capture carbon in 2050. So we need to really get down and say we need to start cutting emissions now. But I suppose in saying that, take a bit of an issue with the word emissions as well. Because again, that is a term that people sort of think about. That's something up in the sky that doesn't really have much of an impact for me. Using a word like pollution might be better because pollution is something that has that sort of more emotional response for people. And instead of talking about emissions and sort of in the atmosphere, we talk about pollution in our environments, in our homes, in the air where we live. Instead of saying emissions harm us, it's the pollution around us that harm our health and harm the planet. So I think that makes it more difficult to ignore as well. I think people can very easily ignore net zero and emissions.
Yeah.
But it's a bit more difficult to ignore when you talk about like you need to cut emissions or ideally pollution today. And you need to cut the pollution that's harming your health today. Language there is quite important.
How do you make the case in a clear way so staff, patients and families maybe feel that this is important to do in their day-to-day lives?
Yeah, and I think that kind of comes down to terminology as well. And like Roisin might have an opinion on this as well. But I think sustainability, again, it's in my title, it's in Roisin's title, it's in our office's title.
Yeah.
But again, it's a bit of a problematic word because again, it doesn't really mean an awful lot to people or it can mean whatever they think it is. It's a bit of a vague definition. So if you want to talk about this in a more sort of real sense to people, I'd like to talk about survivability and a livable future. Because this is what this is about. It's not really about the sort of vague term. It's about our future as a human species on this planet. Like the planet will be fine. It's just whether or not we can remain healthy on this planet. And that's what it's all about. And I think we had an interesting discussion about sustainability in terms of it being a fairly binary concept. Something is either sustainable or it's not. To us now, when we talk about it, it kind of exists on a bit of a spectrum. But that is, I suppose, a sort of made up bit of a concept that it's not based in reality. Because either something we do, it's sustainable in terms of the planet and the planetary systems, or it's not. And if it's not, then we need to start talking about carbon capture again. And like, obviously, we've touched on that already. It's not a viable technology yet anyways.
Is it a bit of we're being nice to ourselves when we use that word, or?
It comes down to the fact that we have enormous power to make a difference.
Yeah.
But I think we've been hiding behind these terms for too long. I think if we actually start talking about it in the way it needs to be spoken about and needs to be discussed, then we could really get down to the action we need to see. Yes, it sounds a bit negative when you say it like this and very much like, oh, you go from sustainability, which is like a benign word, and now suddenly talking about survivability. But I think that's kind of where we need to be at in sort of late 2025. Because we're not in 1985 anymore, we could have afforded to sort of talk about these things in a nicer way. But I think at this point, we really need to say, you know what we've been doing for 25, 30, 40 years in terms of sustainable development, all of that, it hasn't worked. So now there needs to be sort of a little change the way we talk about these things, I think.
You've both said it all through this podcast. It's about the actions we're taking now. It's not about 10 years' time, or it's what we can do now to have an immediate impact on the situation.
Yeah, and I suppose just to flip that, because I do agree with you, it is important to try and keep that sort of positive angle as well. We can all agree that climate change is the biggest threat to human health in its sort of wide variety of issues. But that also means that climate action is a fantastic opportunity for health action. So that I think kind of going forward as well, like in addition to the sort of net zero and all of that,
yeah,
we can also say that climate action is fundamentally health action. And I think if we can kind of sell that message and then in addition to that, maybe take it one step further. And when we talk about all of these things that people often think of climate action as taking something away or a reduction in quality of life. And in reality, what it's all about is to create something a bit better, rethink how we go about delivering healthcare, but also how we live our lives in society. I apologize for the sort of negative framing there a bit, but I think there is definitely positives there.
Yeah, I know. I think it's the practical framing of it, really. Thanks for that. And Roisin, maybe just to give you the last word, really, can I ask what unique strengths does the HSE have that can turn climate ambition into action?
Look, Ireland is a very small country. Within the HSE, we have 145,000 staff. If we can mobilise all of them, both in and outside of work, we can become an unstoppable force for good. Within the HSE, we have a real power to influence other healthcare providers within Ireland, so private healthcare, colleges. We work a lot with the Climate and Health Alliance, and over 30 other health organisations have signed up to a charter to really build kind of the force of action around this. So I think we can be leaders within that group and really drive and share all of the magnificent work that we're doing in the HSE to spread across all of those other healthcare providers.
Okay. And maybe just as a final one, can I ask what can we do to contribute to this work in the HSE?
The one thing I would say, having worked in this space for the last number of years, is there's probably two things if we can squeeze them in.
Sure.
One would be like measure, start to really get a handle on where we are and show improvements. And secondly is, as we've both mentioned, there are fantastic people who are already doing great work in this. So support them, enable them, celebrate, incentivise, make it fun. And I think also get other people involved. So for those people, talk to other people, invest in educating them, and have our leaders support staff on the ground to enable this change.
Okay, thank you. Certainly a lot for us all to think about there, I think. I'd like to thank my guests, Roisin Breen and Dr. Ola Lucan Nordrum, and a big thanks to all our listeners for your continued support, and please share this episode. If you would like more information about HSE Health and Wellbeing, follow us on X, take a look at our HSE Health and Wellbeing YouTube channel, or register for our e-zine by emailing healthandwellbeing.communications@hse.ie. This has been the HSE Talking Health and Wellbeing podcast. Thank you for listening.